As mentioned before, there's about 781 of these relational security officers working in hospitals and healthcare facilities throughout British Columbia. They play a really important role. They have specialized training to be able to use their verbal skills, personal skills to help de-escalate situations. But if needed, they do carry handcuffs, for example. They have the ability to apply them, to use them, and whether that's for safety or for other reasons. Of course, in certain situations, we know that anybody will call 911 or call the RCMP for an assist. But again, as I mentioned, I sat down last week with a group of relational security officers and heard how many times they are able to use those specialized skills they have in a healthcare setting, and hear how the healthcare setting is actually what drew them to this work in the first place, that they really feel they are making a meaningful contribution in working with patients, working with healthcare workers, ensuring safety for people and being able to de-escalate situations. As well, we are always going to be looking at ways to improve this, and looking at weapons technology detection systems, for example, is one such move forward. And we'll continue to be listening to the RSOs themselves, to healthcare workers, to patients, and making changes as we move forward. The vast amount of work that relational security officers do in hospitals is where they do use these techniques to be able to de-escalate and defuse situations. They do have the training to do that. They do have the training and the knowledge to understand when you must call the RCMP, and that situation has occurred. But for most of the time, the work that they do, it doesn't involve that. Of course, that's an incredibly important thing. Weapons have no place in hospitals. The policies are extremely clear. That's why we're looking at technologies like AI weapon detection systems to be able to help discourage that or prevent that from happening, or at least be able to identify situations where RCMP do need to be called, and to be called sooner. With respect to the incident that took place just very, very recently, again, I do understand the police are investigating, that they need to do that work, that we all have questions. We want to know what happened, and that we can draw more conclusions when we know those details, and it'll be appropriate to do that at that time.